Hi everybody, I'm just going to open up the counselling one. I'm going to take you through also counselling, not just counselling that's completed. Okay, I'm going to take you through this one as well. So can you see this? Can somebody let me know if you can see this? If you could put a hand up, can you see counselling? Can somebody see this? Hold up their hands if you can see counselling. Okay, I'm going to get into the actual chat area. If someone could talk to me there, that'd be cool. But I've just gone into our chat area. Can you let me know if you can see this? That'd be cool if you can. Not to worry, we'll get on with it in a minute. Hi, if you can hear me, can you see the blue screen? Like a blue screen. I'm trying to flip between counselling and relationship counselling. So I had 3 participants. Ah, I've got it now. I think I've done it. So wait a minute. Hello. Right now, if you can see this, can you see this? Cool. That's cool. All right. So basically, what I'm going to do, I'm going to do it from this. I'm going to go on about counselling, and then what I'm going to be doing is going on about the relationship counselling. Now, not to worry, because what I'm going to do is redo this anyway. So this is just me doing my sessions with you. So what I'm going to do first and foremost is talk about counselling. Then we're going to go into the relationship counselling. Okay, sorry, but I want you to really understand what counselling is for. So you join the workshop, you've been given relevant codes. To the left of the classroom is a quiz. Once you've completed your quiz, please email team@thedigitalcycle.com. You'll receive a certification of completion. You are welcome to continue development with me and request to join Facebook Messenger practice area. I hope you enjoy the workshop short course. I do use various resources and discuss via webinar, bringing you useful resources from the internet, collaborating that with my own experiences. So there's going to be 2 presentations. So welcome to this professional self-study course on counselling. It has been carefully designed to provide you with all information required to help you become a professional counsellor. Counselling enables you to help others to feel less distressed in time. Your clients may be able to realise productive, satisfying lives. Counselling may not always be easy. You may find that high levels of emotion or negative energy will transfer across to you. It's important to understand professional boundaries. Journaling is very important. So it's a good idea to map your journey by maintaining a journal which records your experiences throughout, as well as any thoughts and feelings as you progress. The ethos to being a good counsellor is to develop an ongoing interesting relationship with your clients. So building strong rapport is essential. Counselling offers much variety on a day-to-day basis. Each individual will have their own reasons and understanding as to their need for support, even if their problems or issues are common. There are very clear boundaries required within the counselling role, and it is so important that you keep confidentiality and explain this may be breached if there's a safeguarding issue and stuff like that. There's also strict boundaries regarding time and counselling sessions, which tend to be 20 to 40-minute time frame in generic terms. Relationship, 50 minutes, I'd say, although appointments may go up to 50 minutes. Never exceed that expectation. Counselling sessions are about working on any underlying issues, and it's imperative to clarify to a client that it takes time for results to occur. Ensure the client and ensure that they feel comfortable. Engaging with them is so important. Speak openly, honestly, and assist the client to have a deeper exploration into any issue. Assist the client to make sense of their problems. Assist the client in their release of their emotions. Assist the client so they can begin to deal with any outstanding problems. And encourage the clients to give you feedback as to what may be helpful or unhelpful for them. In this way, what you can do is tailor an approach to suit that individual's needs. Empowerment is key. Bear in mind that any client has to feel that they can fully trust you before opening up to you. And so, to build rapport and a sense of trust, you must pay full attention to the client without any type of judgment. In other words, the client must direct their own path and decision. Boundaries are essential. As a professional, you must consider your values, assumptions, and any prejudices, as well as any personal or emotional triggers. So if you've got issues, what you need to be doing is dealing with your own underlying issues. To make a great counsellor, it's so important to know your own limitations in addition to resolving some of your own personal issues. Considerations. What is it that you wish to give to others, and what do you want to achieve from being a counsellor? What are your expectations of those that you will help? Are there any emotions in which you are uncomfortable? Are there any emotions that will give you trouble? Are you able to cope with the client's feelings towards you, whether positive or negative? And are you able to control your own feelings towards those that you are helping? You may feel that you will be a good counsellor because you have excellent problem solving skills, but counselling is not just about rushing to solve someone else's issues. The client must be able to learn from the whole process, and you could help map this out with them. Practicing on friends and family in sort of role play situations is very important. Listening attentively, and you'll notice if you have a tendency to actually rush in and try to solve someone else's problem for them. Build relationships because rapport is so important. It's a natural process. Personal versus professional. If you fail to listen fully to the client, you may simply feel that your former problems and their current issues are one and the same and easy to resolve. This actually can lead you to try to influence the client so that they behave in the way that you feel is relevant to you rather than to them. So what that can do is get them to behave in a way that you feel that they should rather than what they need to feel. So when you first start counselling others, you may find it difficult to fully listen and will be a little distracted, but distraction will only lead to you missing that vital information. Make sure you push any thoughts and concerns or issues to one side, keeping your professional hat on and remaining focused. So later, it'd be interesting to listen to see if you've been to a counselling session and how did it feel for you. And you can also practice on each other. Stress. Managing stress. What does stress feel like? When we are stressed, our bodies may show physical signs of tension. Signs of stress can include losing weight, feeling frustrated, sweats, all different types of signs when we're stressed. Some people overeat. Some people have to seek that medical practitioner's opinion because according to the American Psychological Association, the top stressors for the most people are money and work, family responsibilities, health problems of self and of the family members, and the economy. 44% of Americans feel more stressed than they did 5 years ago, and this was done in 2004. 1 in 5 people in the US experience extreme levels of stress, and 3 out of 9 visits to the doctor are stress related. 16 million people in the UK experience a mental illness, and 1 in 4 adults will experience a mental illness at some point each year in the UK. This ranges from anxiety and depression to alcohol dependency and substance misuse and psychosis. Now, what I was going to ask people to do is just get a paperclip, and the reason for this is I would like you to describe to me what a paperclip could be used for. The reason for this exercise is I used to work for Mind, a great organisation. I volunteered there. We would go out and we would do this with other clients because what it enables us to do is build a picture of what that person's mind is like. So effectively, if somebody says they wanted to stab themselves or somebody else, we would know that they would have had some sort of anger issues. Some people might want to clip it in their hair, and you could also see the way that they actually would play with it because we look for cues and gestures and things like that. So verbal language and body language is important, looking at different observations. The relationship between the counsellor and the client can be a very powerful one, so it's very essential to have boundaries. Make sure you do take intake forms right at the beginning, explaining the confidentiality process and also data protection and policies that relate to your work, in order not just to protect yourself, but to protect your client's interests. Now, to be a counsellor, you need to have empathy. Empathy is awareness of the feelings and emotions of other people, and it's a key element of emotional intelligence, the link between the self and others. Give them time to think, take time to listen, understand the client's perspective. Use short responses, gear your response to the client, but be yourself using appropriate language and always respond. When you move into your counselling role, you must be authentic. You must be you. Cognitive empathy follows us to appreciate someone else's feelings without feeling them or losing them in relationship with empathetic. Reflective practice and observation is so key in working with people, because what happens is we need to reflectively look at ourselves and observe and write down and journal also our responses. You may find sometimes that you get mixed signals. An example that a client may declare that they're very angry but they're laughing would be a cue that actually, are they laughing, are they happy, or are they angry? So you reflect that observation and you mention that they have done what they've done, and you discuss it, because it's a very serious and difficult situation. So, somebody who's talking about something really sensitive might be laughing, but that could be the way that they deal with it. What actually this does encourage is the client to elaborate and gain useful insight, recognizing the complexity of their feelings. So be a mirror image to them also, but also don't forget reflective practice of yourself is essential too. Now, it'd be really good if you can get into pairs and do some role play and write down what language and body language cues they use, and verbal and stuff like that. If somebody, when they're talking, laughing, smiling, very important, but please do practice. Communication active listening is intentionally focusing on who you are listening to, whether that's in a group or one-to-one, and in order to understand what he or she is saying. So as the listener, you should then be able to repeat back in your own words what they have said to their satisfaction. This does not mean you agree with it, but rather you understand what they are saying. Bereavement, we're going to be doing bereavement counselling in the relationship counselling, but bereavement is the period of mourning and grief following the death of a beloved person or animal. The English word bereavement comes from an ancient Germanic root word meaning to rob or deceive by violence. When we're doing our sessions, we need to plan the sessions accordingly. The client must complete the form before the session starts, so they need to arrive a little bit earlier. The first stage includes the meeting and a consultation. So you would consult and consider what it is they need. There's so many different types of counselling, which I will go through with you. But the middle section of the session is helping the client to open up so that you are able to both explore and clarify the true situation so that the actual problem can emerge. The final part of the session is where you encourage the clients to discuss decisions and as a result can offer support and guidance when necessary. There's 3 qualities in counselling that's imperative: respect, empathy, and genuineness. Reflect, journal all your sessions, reflecting your own practice. Now, it's very important to set what is called SMART goals. The client can use SMART goals, which stands for specific, measurable, achievable, realistic, timed, which is evaluated and reviewed. Now, with these SMARTs, what you would actually do is set a goal with your client. Don't set goals for them, because that can become unrealistic. The symptoms of bereavement are crying, headaches, weakness, fatigue, worrying, anxiety, problems with sleep and isolation, reflecting on life and death and the purpose of living. Some people do feel suicidal, so you might have to refer people sometimes to specialists. We are not psychologists, we are not doctors, we are not psychiatrists. It's important to signpost somebody when it's necessary. Always put yourself in someone else's other shoes. It's impossible for you to understand every single situation, so you can't say to somebody, I know how you feel, okay? You'll never know how that person is feeling. You could try to be empathetic, but you do not know how that person is feeling. So it's important for you to understand every single situation and be able to identify with every client who walks in that door. But to be able to understand fully, you do need to be able to put yourself in those shoes. Empathy is the key here. It enables us to connect with our situation, but it may not be possible to fully relate to everything that our clients say. Have a task to consider how you would aid those clients who feel oppressed in our society. So someone homeless or somebody with drug issues, what would be your first port of call? Assessment and evaluating sessions is very important. Is there a strong enough relationship for ongoing sessions to be productive? Are you able to provide the right sort of help for the client? Is the client motivated sufficiently to change? Create goals. They are firmly caught in an ongoing dilemma. The goal seems to be achievable, but the client is unable to determine how to reach it. The goal was created by someone other than the client, so there is no commitment. There are too many goals. They cannot decide, and a potential goal may have negative consequences. The client is unable to commit to a goal. The client lacks support and encouragement. Create realistic goals. Providing that ongoing encouragement and support is important. Also, what you would be doing is gathering in the intake form social and economic influences and throughout the session, family background, their personality, what's their culture, is there any other outside factors? Because what we're looking at is psychology is the study of the individual. We are then connected to society, which is sociology, which is the social impact, it's the environment, it's those things that we have norms for. So some people's norms would be different to somebody else's. We have subgroups and subcultures and lots of different cultural backgrounds, religion, what's their peer group, what's their pressure groups, what's their educational experiences. All of these things need to be taken into account. I actually have studied psychology and sociology at a degree level as part of my degree. I also did it as ASs as well. So I'm very equipped. I should have, I wanted to be a clinical psychologist, but however, it's not, we are looking at the individual, but what we're doing is we're bringing in different dynamics. We'll be bringing in different methods. And what you need to be doing when you're doing counselling is working out what method would best suit the person. And that's why we use a lot of development, continual development in counselling. This is a really good resource, okay? Jared, Egan, and Arnold Lazarus. And this is a model that most people do use in counselling. So each person is an individual with different experiences, helping them form who and where he or she is today. The Best I, Best R model will remind you of this: body, emotion, sensation, thinking, imagery, behaviour, environment, spirit, time, and relationships. Gathering all these information. So at stage 1, you would do exploration. This stage takes us at least a quarter of the time in single or early sessions of the series because it includes getting to know you time. Trust is important. Establishing that trust with your client is imperative. Exploration may less time later in the helping of relationships. Stage 2 is understanding. This usually takes half of the time of the encounter because you have to try to understand why the person has come to you and what it is they require. And then stage 3, you action. Around a quarter of the time is given over to deciding what action is taken after the session. So first of all, you explore. Second, you try to understand what the problem is. Third, you take action. So you put a plan in place, encouraging the person to actually be part of that. Empowerment is key. Engagement is very key, because if someone's not engaging with you, there's not much you can do. And a counsellor should give the person speaking full attention. Repeat the conversation back to them in their own words. By reflecting the content of what is being said back to the speaker, check their understanding of the message. Clarity is very important. Be as accurate in summarising the client's meaning as much as they can. And try again if their phrasing is not accurate or well received. Never put your own words into someone else. And especially if it was to come to say, they were saying something about abuse, you cannot change that, because in safeguarding you have to write it as it is. And if you did come across a safeguarding issue, you write it exactly as it is, and you then have to explain that you do have to divulge that information to the relevant safeguarding departments. You would phone social services assessment teams. A counsellor should never talk about themselves, change topics thinking about what they will say next. Advise, diagnose, reassure, encourage, criticise, discuss own issues. Using it's not very professional. And pretending to have understood the person on their meaning. Allow the client to drift to a less significant topic because they feel the counsellor doesn't understand. And fixing and changing or improving what they have said or finishing their sentencing for them. filling every space would talk, ignoring their feeling in the situation. We are each responsible for our own feelings. People react in various ways to the same events. So our reactions are not inevitable. They are the result of history. Look after yourself. A deep breath. Your time is very important to you too. Note your feelings and thinking and behavior and summarize you too. There are some clients who will be unable to help unless you develop your skills further and specialize, and this includes addictions, those with drug dependencies, mental health issues, PTSD, suicide tendencies, self-harming, and etc. And some places where there's children involved, and it is to do with family court stuff. Those with drug dependencies, mental health issues, PTSD, suicide tendencies, self-harming, those taking prescribed medication for psychiatric treatments when setting up counselling practice, always provide a positive service. It's imperative to be patient throughout, even if clients are difficult in their situation. It's far more intense than originally assessed. Remember that the client is important. Your goal is always to help and support them in a professional capacity. While this course is theory-based, the emphasis on practicing the techniques and suggestions lies with you. Make time to use techniques and consider the importance of developing active listening skills. The client should be guided by you, supported and encouraged by, but the client does most of the work. You simply prompt and question where necessary. If you are unsure or feel unconfident as to the information given, you need to be researching. Here's a really good tool, Counselling Skills Basics. So it looks at reflecting and paraphrasing, summarizing, questions, focusing, rapport, silence, and the basic counselling skills. Ethics are guidelines that are based on the basic principles of the Counsellor and Practitioner Code of Ethics, Corey 1996, which briefly outlines 5 principles in which therapeutic boundaries are based upon. Benefits. A counsellor must accept responsibility for promoting what is good for the client, with the exception that the client will benefit from the counselling session. Doing no harm. The counsellor must avoid at all times, even inadvertently, any activities or situations with the client that could cause a conflict of interest. The counsellor's ethical responsibility to encourage client independent thinking and decision making, and to defer all forms of client dependency. The counsellor's commitment to provide an equal and fair service to all clients regardless of their age, gender, race, ethnicity, culture, disability, socio-economical status, being honest with clients and faithful, and honouring the counsellor's commitment to the client's progress. Here are the regulations here for the United Kingdom and other sources that I recommend that you do read. Okay, so that's an introduction to counselling. What I'm now going to take you to, so I'm going to stop that share, I'm going to now take you to relationship counselling, share this one with you, and let's get straight into this. I'm going to now go to slideshow from the beginning. So welcome, this is relationship counselling. So there's various, like I said to you, there's various types of counselling. We have marriage and family counselling, guidance and career counselling, rehabilitation counselling, mental health counselling, substance abuse counselling, bereavement counselling, relationship counselling, educational counselling. Behavioural therapy is a therapy, okay, so that's different, it's therapy. Cognitive analytical therapy, cognitive behavioural therapy, which we will be covering, CBT, cognitive therapy, family therapy, gestalt therapy, hypnotherapy, which I do teach, integrative approaches also. Now, behavioural therapies are based on the way you think. That's cognitive. Cognitive is your mind, it's thinking, and or the way you behave. These therapies recognise that it's possible to change or recondition our thoughts or behaviour to overcome specific issues, okay? Psychoanalytical and psychodynamic therapies are based on individuals' unconscious thoughts and perceptions that have developed throughout their childhood and how these affect their current behaviour and thoughts. There's a humanistic approach, which is called humanistic therapies. This focuses on self-development in the here and now. Many counsellors or psychotherapists practice integrative therapy, where they blend the specific types of technique. Other practitioners use what they call an eclectic approach. And this is taking the elements of several different models and then they combine them. So different approaches can be used in the counselling and psychotherapy process. Alfred Adler the founder, to focus on creating a therapeutic relationship that is cooperative, encouraging, and practical. It's very important to help clients explore their unique lifestyles, private and logic, their core beliefs about themselves, others, in the world. So it's looking more at the individual psychologically, and then looking at the world around them sociologically. So this increases the understanding and the challenge of habitual patterns of behavior, which is hidden goal. It's an educative process of dialogue, an insight of encouragement and reorientation, which enables towards useful involvement and contribution to society as a whole. So also we have systematics as well. So sociological have so many different aspects because we have social spheres. And in those social spheres, we have politics, we have things that actually ground us. You know, we have financials, we have hierarchies, we have different class systems, we have different needs, we have the Maslow's need system. So looking at, you know, people with the basic needs, needing shelter, needing food, and all of those things. You look at the whole picture, and what you do in counselling is map out exactly where that individual is. And throughout this course, what I'm going to be teaching you is all those wonderful techniques. So behavioural therapy is based on the belief that behaviour is learnt in response to past experiences and can be unlearned or reconditioned without analysing the past to find the reason for the behaviour. So what the behavioural therapy does is actually look at the past experiences and then see if they can be unlearned or reconditioned. So a lot of people that would say be having behavioural issues such as anger and repetitive behaviour. What behavioural therapy would look at is to see if we can change patterns. Brief therapy is the cognitive behavioural approach with a small planned number of sessions and possibly a single followed up session after some time has elapsed. What I'm going through is the different therapies here. Cognitive analytical therapy combines cognitive therapy and psychotherapy, and what it does is encourages the client to draw on their own resources to develop the skills to change destructive patterns of behaviour. So it's looking at ways of thinking and changing that negative thinking and exploring the treatment around that. So it's very structured and directive, and it's involving diary keeping and progress charts. A lot of the time before people are diagnosed with things like bipolar and stuff like that, what they would go through is directive structured program where somebody would actually get that person to do a diary, and then that diary is kept with progress charts to see if that person has had a pattern, say for a period of 2 years. We're not psychologists, we are not psychiatrics. So what I'm saying to you is, if you have somebody that comes into you and they have mental health issues and stuff like that, what you would need to be doing is referring that person for that specific treatment and to a therapist, such as a cognitive analytical therapist. So cognitive behavioural therapy, we will be looking at later, combines cognitive and behavioural techniques. Clients are taught ways to change thoughts and expectations, and relaxation techniques may be used. So we will look at that in further depth later throughout the course. You heard me mention this. Eclectic counselling involves selecting what is applicable to the client from a range of theories, methods, and practice. So justification is based on the theory that there is no proof that any theory, any approach works better than any other. Okay, they combine it. Also, we have EMDR, which involves stimulation of either the lobe of the brain by using eye movements, which is believed replicates what appears to happen in REM sleep, REM sleep. So REM sleep, all to do with rapid eye movement, okay? This allows a natural processing of traumatic events or disturbing memories to take place. It's particularly useful for those that suffer with post-traumatic stress disorders, because what happens there is I did this in my diploma as well. What happens there is people with post-traumatic stress disorders, what they tend to do is suppress their memory. So eye movement's really good. What you do is you actually look at the eyes where they're looking in response to you asking a question. Their eyes might go up, down, to the side, to the left, might roll. And what we do is we look at and analyze the eye movement. I'm not covering that in this. Also, we have existential counselling. This is based on the belief that life has no essential given meaning. Any meaning has to be found or created. It involves making sense of life through the person, through their worldview, and includes a willingness to face one's life and life's problem. This wonderful therapy was organised how and is based on the belief that the human response to experience is summoned up in a person's thoughts, feelings, and actions. The client gains self-awareness by analysing behaviour and body language, giving expression to repressed feelings. Treatment often includes acting out scenarios and dream recall. And then we have human Gibbons therapy, which encompasses all effective approaches to helping people whatever has occurred because of ideology. It is truly holistic, scientific, and practical. Humanistic psychotherapy embraces techniques coming from the personal growth movement, encouraging people to explore their feelings, taking responsibility for their thoughts and actions, which emphasizes on self-development and achieving highest potential rather than dysfunctional behavior. It's very client-centered or non-directive, and it's an approach that is often used, and this therapy can be described as holistic. The client's creative instincts may be used to explore and resolve personal issues. Integrative counselling is when several distinct models of counselling and psychotherapy are used together in a converging way rather than separately, and many counsellors use one core theory model of counselling but draw on other techniques and styles from other approaches when appropriate. Neurolinguistics, which is NLP, which I also have a diploma in, is described as the psychology of excellence. What it does, it sees the world of excellence where people can be facilitating and creating their own choices and flexibility. Presuppositions are used as the basic operating principles. Some examples being human behavior is purposeless. It has a purpose. We either already have all the resources we need or we can create them. So modeling successful performance leads to excellence. If one person can do it, possibly others can teach it and learn it. In NLP modeling, it means finding out how someone does something. The core of NLP is the process of replicating excellence with a goal of excellence for all. It is really good, actually, NLP. So primal therapy is based on the theory that suppressed birth or infancy traumas can resurface as neurosis. And the therapy takes the client back to the primal scene where trauma can be re-experienced as emotional cleansing. What we do is we take the person back and we go straight back to where the actual issue lies and try to go forwards, but also having to deal with the actual issue from the past. Very, very strategic. Psychoanalysis focuses on the word of Sigmund Freud, must have heard of Sigmund, father of psychology, who believed that the unacceptable thoughts of early childhood are banished to the unconscious mind, but continue to influence thoughts, emotions, and behavior. The feelings are repressed, which can surface later as conflicts and depression, or through dreams or creative activities. The analyst seeks to interpret, make acceptable to the client's conscious mind, troublesome feelings and relationships from the past. Transference into the analyst of feelings about figures in the client's life is encouraged, and this type of therapy is often used by clients suffering high levels of distress and can be lengthy and a very intense program. Psychodynamic counseling or psychotherapy stresses the importance of the unconscious and past experience in determining current behavior. So the client is encouraged to talk about childhood relationships with parents and other significant people, and the therapist focus on the client-therapist relationship, the dynamics essentially. So the psychodynamic approach is derived from psychoanalysis, but usually provides a quicker solution to emotional problems. Now we have psychosynthesis and transpersonal, and sometimes described as psychology of the soul, which aims to integrate or synthesize the level of consciousness at which thoughts and emotions are experienced with a higher spiritual level of consciousness. Painting different parts of the personality. Painting movement and other techniques can be used to recognize and value different personalities. It can be useful for people seeking a more spiritual oriented vision of themselves. Rebirthing is based on the theory that emotional or physical traumas during birth create feelings of separation or fear in later life. Normally hear of that of like attachment disorders, where someone feels detached, so you get detachment disorders where say a mother was taken, the child was taken too early from the mother, and then the person then presents different issues later on in life. That is rebirthing. So this technique is used individually. The breathing techniques are used to release the tension while the client re-experiences those traumatic emotions. Very, very intense. Solution-focused brief therapy promotes positive changes rather than dwelling on past problems. Clients are encouraged to focus positively on what they do well and to set goals and work out how to achieve them. As little as 3 or 4 sessions may be beneficial. You have systemic therapies, or therapies which have as their aim a change in the transactional problem. I'll get it out. Transactional pattern of members. It can be used as a generic term for the family therapy and marital therapy. So with all these different techniques, what you would be doing is you essentially, when you first have your client, they come to you, what you do is you listen and you would pick which therapy suits them, and then you would refer. There is times when you just sit and listen throughout that session, and what I would do is then put a plan into place, and you would talk through with the client what's the best way forward, and you work out which therapy works for which one, which model is going to benefit that person. Transactional analysis, so TA, is based on the belief that everyone has the child, adult and parent self within them. If you heard of id, ego, superego, this is social interaction. Oneself predominates. It predominates. So basically, if you've got someone with superego that's very predominant, what they would do is they have that row, and it's very, very fixated. So you have, say, a male who's like dominant figure, and it's you know. But at the end of the day, we all do have id, ego, and superego within us. So what this does is recognize roles, so a client can choose which one to adopt, and so change that behavior so they can become more pacified. This form of therapy has produced the term inner child, so it's used to describe unfulfilled needs from childhood. Transpersonal therapy describes any form of counselling or psychotherapy which places emphasis on spirituality, human potential, or heightened consciousness, and it does include psychosynthesis. You have person-centered counselling. This is based on the assumption that an individual is seeking help in the resolution of a problem that can enter into a relationship with another individual, us, counsellors, who is sufficiently accepting and permissive to allow the client to freely express emotions. This enables the client to come to terms with negative feelings which may have caused emotional problems and develop inner resources. This is the one that you'll be really, really working with, is the person-centered counselling. Humanistic therapies help individuals recognize their strengths, creativity, and choice in the here and now. If you're doing relationship counselling, it's better actually to have 2 parties. So welcome to this professional course in relationship counselling. It is an in-depth study course considered as an add-on for professional counselling. It is also suitable for study alongside any traditional counselling qualification. So basically what I'm going to do is now talk you into the relationship counselling bit. So if either client is turning to alcohol or drug use, even as a primary way of coping, With the problems in the relationship, emotionally focused therapy is not to be considered in the first instance. It is far better to recommend the client to seek the behavioral therapy. Okay. Limitations. You can't really work with the domination of the partner, trying to control the relationship, power control tactics that are being used, violence is occurring or threatened, control tactics, emotional abuse, using children as weapons, refer to specialists or behavioral therapists, okay? Relationship therapy will not be helpful if one or both partners are indulging in an affair with others, if they have no desire to finish this affair. So it's very important to be only working once the affair is over. It will also be unhelpful when one or both of the partners have unresolved mental health issues, as in the following examples. Depression, this is clinical depression which needs to be treated successfully before relationship counselling can take place. Post-traumatic stress disorder, this may be caused through emotional abuse, so physical abuse or sexual abuse, and should be treated as a priority before relationship counselling takes place. So here, what you would be doing is referring, okay? Personality disorders, this must be prioritized and treated before undergoing relationship therapy. So what I'm teaching you here is relationship therapy, okay? You are not going to be doing the ones that have been mentioned, like cognitive therapy and stuff like that, behavioral therapy, that they're specialist areas. We are talking specifically here about relationship counseling. Okay? Counseling looks at the emotions behind the cycles and the aims for the relationship and the closeness. It's advantageous to see both clients together rather than seeing them individually. Remember what I was saying about individual? Individual is the singular person. Now this is two people, so you have to be looking at the issue, not at them as individuals. That's very important. Both partners are responsible, and so both must work together to aid progress. Quite often men are very reluctant to go to counselling session because they're worried that they may be blamed for the current situation. That happens quite a lot. We very much, sticking up the men here, we very much blame men for everything. And they feel like, oh, I'm an abuser. It will often be the man that actually blames himself for a behavior of the woman, because they've taken on this tremendous sociological role of the man. You know, I'm breadwinner, I have to be a certain way, I am responsible for my family, I am responsible for the mother. But never judge, never assume, okay? Because sometimes there could be violence invoked, and if there is, refer. What I'm saying is, a lot of the time, scientific, I'll have to get the stats, but it has been proven that men are always reluctant, not all, but some, to go to counselling sessions. Focus is important. When you're working with clients, you must understand that it is the relationship that is the client and not the individuals involved. So it is the focus is the relationship. That's what you will be looking at, not the individuals involved. Your focus has to be on the issue itself. I hope that's helped you for today. We'll do part 2 very soon. Sorry, it's been quite a long session and I don't want to go on too much because it's a lot to take in. Please research. I have put links in there as well, okay? Thank you so much.